Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a blanket, and a mat. We are going to focus on the practice of Virabhadrasana 3, a posture which calls for stability, strength, as well as flexibility of the lower extremities. We are also going to add few postures in between to make Virabhadrasana 3 more effective. We shall first begin with some core stretches. Lie on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms, especially when you close the eyes. You must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Raise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, raise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, Hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh, then rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh, from left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore, this stretch is also very useful. Release the legs, rest the legs on top of the chair, chain, fold left leg, left ankle on right knee from right hand, hold the right thigh, pull from left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg, then rest the left leg also on the seat of the chair. Rise both legs up, fold, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Chest and navel up. Watch your breathing. We are going to do the following. Hold the chair, take your right leg forward, right knee bent at 90 degrees, chest and navel up, and then gently flex the right knee as much as possible. Press the right foot. Hold the chair so that you get a good orientation for the trunk. The pelvis should not turn. So chair helps to get a good orientation. Watch the line and length of the left leg. Take care of the orientation of the left leg. It should not sway sideways. In this posture, the right hip is in flexion, left hip is in extension. This is a very good posture for the hip flexors. One of the important movements which would help the practice of other postures. Slowly come up, right leg back, chain, left leg forward, press the left foot, then gently flex the left knee as much as possible, chest and navel up, look forward. Watch your breathing. Watch the base of the spine. It's also good for the knee. Left knee is in flexion, right knee is nearly neutral, left foot is in dorsiflexion, right foot is in plantar flexion. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. The differential movement at the hip is very beneficial for the base of the spine. Slowly come up, take your left leg back, sit on your heel. Keep the complete spinal column well aligned. Keep a chair in front, a blanket below the knee. Watch your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Stand up. Stand in front of the chair. Join the heel, join the big toe, pull both the kneecaps. Bend forward, hold the seat of the chair, keeping the trunk nearly parallel to the ground, both legs straight, pull the kneecap. You can rest the forehead on the top bar of the chair, then slowly rise your right leg up. Right leg straight. Pull the kneecaps. Left leg perpendicular to the floor. Trunk and right leg in line and parallel to the floor. You can flex the elbows. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Slowly bring right leg down and chain. Left leg up. Left leg straight. You should raise the left leg to the height of the hips. Keep it in line with the trunk. Pull the kneecap. Watch your right ankle joint, knee joint and the hip. Keep both the hips even. That is, when you raise the left leg, you should not allow the pelvis to turn. Feel the right back of the thigh, the hamstring muscles and the gluteal muscles. Slowly bring your left leg down. Sit on your heel in Vajrasana. Virabhadrasana 3 is an excellent posture for the lower extremities. It gives good load bearing to the joints of the lower extremities. It also calls for stability of these joints. Initially, it may be good to use a chair to get good support, good balance and correct postural alignment. Vajrasana helps the lower extremities. It's also good for the spinal muscles. Kneel down, right leg forward, bend, hold the chair, stretch the right foot to press against the lower rib of the chair. Keep the right knee flexed. Chest and navel up, press the heel down and pull the heel towards you and push the left knee. This action activates the back of the right thigh, the hamstring muscles. Ensure in the beginning to keep the knee slightly flexed. Then gently straighten the right leg. Extend the knee completely, pull the kneecap, straighten the quadriceps, chest and navel up. So this will ensure a good stretch for the Achilles tendon, the calf muscle as well as the hamstring muscles, the back of the thigh. For that you have to raise the chest and navel up. So this is where the chair helps you further. It gives a good support for you to push the right thigh down and lift the navel and trunk up. Slowly take right leg back, chain. Left leg forward, foot against the lower rib of the chair, left knee slightly bent to begin with. Press the left heel and pull towards the right knee so that the back of the thigh becomes active. Chest and navel up. Then gradually extend the left knee, pull the kneecap, stretch the heel, push the root of the left thigh down, lift the trunk and navel up. This is a very useful posture to tone the back of the thigh, the hamstring muscles. One of the very large muscles group that we have, and it has a very high degree of participation in many postures. Slowly take the left leg back, sit upright on your heel. Ideally, heel should be together and hips should sit on the heel. Watch your breathing. Be seated upright, watch your breathing. The hamstring muscles play an important role. So it is also good to tone the hamstring muscles for better action. Stand up. Stand in Tadasana in front of the chair. Both legs straight. Bend forward. Hold the seat of the chair. Note the position of the foot. Slowly rise your right leg. Flex the elbows. Take the head slightly below the top rib of the chair so that you get an enhanced stretch at the gluteal muscles and the hamstring muscles. Right leg straight. Keep on pulling the kneecap. Keep both the hips even. So chair should help you to stay a little longer and get good alignment. Take your right leg down. Chain, left leg up. Both legs straight. You can flex the arms and take the head little down. So when you bend the trunk little further down, the hamstrings become that much more active. Press the right foot firmly, ensure that you have even pressure on the heel and the sole, right leg perpendicular. Slowly bring the left leg down. Sit down on your heel in Vajrasana. So chair will help the beginners as well as the seniors to practice this posture safely, and it also helps the advanced practitioners to work precisely on the alignment. Stand up. Sit on the chair. Sit to your right side. Press the foot properly. Chest and navel up. Hold it over the chair. Inhale, exhale. Turn to your right side. Grip the chair and turn. Keep the shoulders even. Turn the neck also in the direction of the twist. With every inhalation, you should stretch the trunk. With every exhalation, you should twist the trunk. And then watch your breathing. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Do not hold the breath. Twisting postures help relieving the stress in the lower back, also helps the intestinal organs. Slowly come up, change sides, sit to your left side. Sit upright. Hold it over the chair, inhale, exhale, turn. Use the grip. Use your forearm and upper arm to induce a good stretch for the rotators of the trunk. The oblique muscles of the abdominal region also stand to benefit from twisting, and proper breathing ensures good massaging effect on the intestinal and pelvic muscles and organs. Slowly come up. Sit upright. Stand up. Sit on your heel. This is an important asana which would help the foot, ankle, knee, and it also gives a good stability and balance. Stand up. Stand in front of the chair. about 6 inches away from the chair. Both legs straight. Bend forward, hold the top of the chair. Now bend the trunk a little more, taking the forehead closer to the seat of the chair. You can rest the forehead on the seat of the chair. Now slowly, gently raise your right leg up. Now the moment you bend the trunk, actually you should not flex the spinal column. There is flexion of the hip. So when you bend the trunk like this, keeping the spinal column straight, it would engage the hamstrings and gluteals much more intensely. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. You can flex the arms. Now slowly bring the right leg down, then chain. Left leg up. Stretch the spine. Do not buckle the spine. Rest the forehead. If you are not able to rest the forehead directly on the seat of the chair, you may keep a couple of blankets on the chair. Both legs straight. Keep on pulling the kneecaps. Ensure that the left thigh does not roll out. You should align the joints properly. Watch your posture. Be in the posture. Be with the breath. Slowly bring left leg down. Sit in Vajrasana. Sit upright. In the conventional Virabhadrasana 3, we are also supposed to stretch the arms. It is important to involve the upper extremities also in Virabhadrasana 3. Navel up. Line your chest, keeping the chair in front. Rest the wrist on the edge of the seat. Press the palm on the seat of the chair. Both arms straight. Relax the neck. Stretch the toes back. Tighten the calf muscle. This is a good stretch for the shoulder joint and also the upper chest. Neck also stands to benefit. Be strong on both the arms. Tighten the muscles of the upper arm and forearm. Press the palm. Middle fingers pointing forward. Relax the neck. And if possible, rest the forehead on the mat. Flex both arms and relax. Press the palm. Slowly get up. This gives a very good stretch for the arms, the scapulae, as well as the upper chest. Sit upright in Vajrasana. Watch your breathing. Stand upright. Stand in front of the chair. Rest the wrist on top of the chair. Then slowly walk back. Stretch both arms. Both legs perpendicular to the floor. And watch the trunk. Trunk should not buckle. You should maintain the integrity of the spinal column. So this is more a hip flexion. Arm straight, legs straight. Engage the muscles of the arms. Engage the muscles of the thigh. Breathe well. So this is a preparatory posture for Virabhadrasana 3. Keep on pulling the kneecap. Watch your hamstrings and the gluteal region. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. This posture is also good for your spinal muscles, thigh and the hip, as well as the arms. Slowly walk forward. Relax the arms. Stand upright. Rest the wrist on top of the chair. Walk back. Arms straight. Stretch the trunk. Both legs straight. Both legs perpendicular to the floor. Slowly rise right leg up. Arms, trunk and the right leg all in the same line, parallel to the ground. Left leg perpendicular to the ground. Engage the muscles of the upper arms, forearms. Engage the muscles of the legs. Slowly bring right leg down, chain, left leg. And ensure that the pelvis do not roll out when you raise the left leg or right leg. You should ensure to keep the hips even. Be strong on both the legs. Watch your right ankle, knee. Feel the balance. Feel the muscles. Do not hold the breath. Slowly bring your left leg down. Gently walk forward. Release the arms. Tadasana. Sit upright on the chair. Foot properly placed on the ground, foot parallel, chest and navel up. Tip of the thumb and index finger in contact. Relax your tongue, nose, throat and the jaws. have complete postural awareness. Now you are going to do the following: the complete breath. In this, as you inhale, the bottom of the abdomen, middle, then the top, then the bottom of the chest, middle of the chest, top of the chest should gently, smoothly, all around expand. Then simply relax. Chest contracts, abdominal cavity also contracts, and the breath comes out. That is effortless exhalation. Watch the anterior, posterior and the sides of the complete trunk as you breathe. Sensitize also the back muscles to the breathing. As you inhale, the bottommost portion of the abdomen, that includes the pelvis, then the middle, then the top, then bottom of the chest, middle of the chest, top of the chest should expand. Then simply relax and experience an effortless exhalation. Try to make the exhalation longer than the inhalation. Now you are going to do one more type of rapid, forceful breathing. In this, you have to contract the abdominal cavity and the chest cavity. Expel the breath quickly, forcefully. Watch the forceful flow of the breath through the nostrils. Then suck the air forcefully, quickly from the nose. Watch the region around the nasal cavity, especially the sinus sprockets. Understand the procedure properly. This is forced rapid inhalation, forced rapid exhalation, where there is focused attention at the two nasal cavities. You have to contract the abdomen and chest. Forcefully expel the breath through the nostrils. Then suck the breath through the nostrils, forcefully and quickly. Repeat this process, but ensure that you are seated upright, chest and navel are well aligned. Keep the tongue, nose, throat and the jaws relaxed. Remember the procedure, and this process don't go after too many number of cycles. Maybe you can start with some 21 cycles, then simply relax, watch the calming effect, watch your sinus sprockets, watch the all the cavities in the skull. Just develop a feel for the skull cavity. And even here, when you end the number of cycles, let's say 21, immediately after stopping the rapid breathing, you will feel a state of deep calmness setting in for a few seconds. Experience that calmness. One more time we are going to do. This breathing technique is very useful, especially for the upper cavities, in and around the and above the nose. It also helps the lungs and the heart, as well as the intestinal organs. Be relaxed. Watch your pelvis, abdomen, chest, and the skull cavities. Watch the relaxed, free flow of the breath. Go deep into your own self. Watch your body, watch your breath, watch your mind. Get completely, deeply involved. Feel the deep sense of relaxation. Namaste.